Good morning, I'm Dr. Michael Nusbaum.
And I'm Dr. Daria Klachko, Totten.
And welcome to
HealthTalks.
HealthTalks. So what are we talking about today?
We're going to talk a little bit about a relatively new medication that, finally there's a relatively new medication that has come out to help hot flashes.
Okay.
So let's review a little bit about what is a hot flash. A hot flash is a sensation of flushing that occurs mostly in the upper body and the face, and warmth. It can last seconds to minutes, and it can be relatively distressful and sometimes very distressful for women who are transitioning in menopause.
I was going to say, this is the perimenopausal period.
Yes.
Okay.
We have to always set that up here.
Yeah.
Yes, it is. We're talking about women. We're talking about the menopausal transition.
Okay. What's the medication?
So it's a medication called Veoza, and it's pretty new on the market. And as I said before, there's been no new changes in so long for women with hot flashes. So This is something that's FDA approved and seems to really work. And the good thing about it is it's a non-hormonal option.
Oh, awesome.
So those women that can't take hormones or don't want to take hormones, this is a great option.
That's really interesting because a lot of patients, are concerned about being on a hormone because of either a history of breast cancer with themselves or family history of breast cancer. So this is not a hormone. So that's terrific.
This is not a hormone. So those women that are worried about it or hormones are contraindicated, this is a great option to try. In our brains, there's a balance between estrogen and neurokinin B, which is a chemical found in the brain, and that kind of helps us regulate our temperature.
Interesting.
So when our estrogen starts to decrease, the balance is off and hot flashes can occur.
Interesting.
So what this medication does is it's a neurokinin B receptor antagonist, so it reduces that effect on the brain.
So this is really just going to affect hot flashes, not really anything else related to
and that's a really good point.
Okay.
Exactly, that's a really good point. This is just for hot flashes, and it can significantly reduce them. So, this is found to help women who are really distressed with the amount of hot flashes that they're having, and it really seems to help. One of the bad things, what are the bad things? So what are the side effects? So, the usual nausea, vomiting, and you have to be careful because sometimes this medication can increase the liver enzymes, which can lead to yellowing of the skin, yellowing of the eyes, which is reversible, but it can affect the liver.
So about jaundice?
I'm talking about jaundice, yes.
Okay.
Yes.
So that's obviously something you can easily catch in blood work. So are we doing routine blood work while on the medication?
Absolutely. Okay. So this is a medication that is taken daily, and you should get your blood work taken. So generally, once you start, it's at the 3-month mark, the 6-month mark, and the 9-month mark, you have to go for blood work.
Okay. So, if you're noticing that your sclera, the white of your eyes, is starting to get a little yellow, that's one of the signs, correct?
Absolutely.
Okay. So,
absolutely.
It's like teres, and that's something you could probably easily identify and say, hey, I need to get some blood work done because I'm noticing some yellowing, and your doctor can then, do they lower the dose? They stop it completely?
You probably would have to stop it completely.
Okay.
Yeah. But that's something that it should be monitored and it should be checked. And another interesting thing about this medication is watching out for caffeine consumption, because that seems to increase the levels in the blood. So something that you have to talk to your doctor about with any medication you take is what are the side effects and what are the risks and what are the contraindications. And also, this can react with other kind of medications. So you want to be able to ask your doc, what kind of medications do I have to be careful with while taking this medication?
Sure.
So people with chronic liver disease, kidney disease, and certain meds, really have to think about, maybe using something else.
Absolutely. And your doctor will probably know that and won't prescribe this medication if you already have active liver disease or kidney disease. So,
Yeah. But it's something to consider. And you know what? It's great that something else is out there.
Absolutely.
Something else can help you. But definitely, we're all unique, and we all have to, look at our own, what we need, and base our treatments on that.
Absolutely. Well, there's a treatment for hot flashes, guys. So
Yay!
terrific. And it's not hormonal.
It's not hormonal.
Well, thank you for that. That's awesome. Takeaways?
Talk to your doctor. If you ever are not feeling well, this is something that's important. The menopausal transition can be hard. It's something that you really need to talk to your doctor. Open up, ask for the help. If you're not getting the help, find a way to get help. You can look for, doctors like me who have an interest in menopause and go for a consultation.
Terrific.
Yeah.
There is an option. I'm Dr. Michael Nusbaum.
Dr. Daria Klachko Totten.
And thanks for joining us at
Health Talks. Thank you.
Thanks.
Bye.
Bye.